Hi, Eric. It's good to see you again. Eric is one of our new Lyme patients, and he stopped in the office to thank me for helping him with his serious pain and other issues. You've had pain since you were how old?
Yes, I want to start by saying thank you so much. The first 5 days, my pain levels dropped 80%, even a little bit more. I've had pain issues since, and memory and brain issues since I was in the last 15 years, and even pain issues since the age of 12. And I've seen over 25 doctors in the last 15 years. I've been to one of the top clinics in the United States. And nobody has ever been able to take even the slightest edge off of it till I came here.
And you just started last Tuesday.
Monday.
Monday, so
Yes.
It's been a week today, and so that's good. One of the things I wanted to stress, I like to stress the fact, or emphasize the fact that Lyme is a brain disease, and we know that the Lyme spirochete is in the brain within 12 hours of a mosquito bite or tick bite, and other vectors are carrying it. But the main thing is the pain that people have, and the brain fog, all kinds of symptoms. And I think you mentioned at one point you'd actually had some brain fog issues or inability to focus starting around age 12.
Yes, I had a hard time in school. I could read stuff and it just wouldn't stick, and I had issues with memory and everything.
One of the things, and all those issues get worse when you develop Lyme disease or infections, brain infections of other bugs like Babesia, etc., Bartonella, which will end up proving some of these things here in your stay. But to get rid of your pain so quickly, you're a perfect example of what I talk about, brain first.
Right.
Treat the brain first. And when I met you last week, I think without looking at your chart, after watching you for a few minutes and the other folks in the room, I told you that, in my opinion, you had inherited a few things. And here's the deal. Let's talk about a couple of things. I told you that, in my opinion, and based on treating thousands, that you had inherited an underactive reward center. And the reward center runs on dopamine, and actually it is activated when this particular receptor is activated. I can do the laser. I'm not sure how well that shows up on the camera. But the dopamine D2 receptor is what runs the reward center. It's the hunger center, sex drive center, and it's your happy pleasure center. And some people inherit less than normal receptors. And there's just a lot of people out there. So if you inherit 10% or 20% less D2 receptors in the reward center, you're not frankly depressed. People who inherit 50% less, the lowest they've seen in any of the PET scan studies at the NIH and universities in Europe, those people are frankly depressed. But folks that inherit 10 or 20% less are not frankly depressed. They're just less excitable about Christmas presents or Hanukkah or whatever else is going on. Then the toxins from Lyme. I know clinically, not from studies, but from watching thousands of patients, they block the dopamine molecules from the receptor, and we see a major shutdown in the dopamine D2 activity, and then there's more depression and less motivation. But if you inherit this much less activity, the infections make you this much less active. And that's the problem with a lot of people out there. None of the brain things are actually looked at. The other region that I thought was underactive in you, most likely from genetics, is called the prefrontal cortex, and it's the region behind the forehead, and it's the executive center, which provides top-down management for the brain and the rest of the neurological system. And beyond the inheritance, we know that from Japanese studies that just came out recently that the Lyme spirochete congregates in that prefrontal cortex. Almost like a nest, it congregates in this region. The problem with the brain fog and the ability to function at a job or in school is that the 4-second processing memory or learning memory is right here in the temporal or in the temples, and so it's called the lateral prefrontal cortex, a medical term. That's the first region that shuts down in Lyme patients. So you can't remember when you walk from this room to the next room in the house. Well, what did I come in here for? A fork or a screwdriver? You know?
Yeah.
Does this sound familiar?
Yes.
And it makes it difficult to work. So if you inherit the least bit of underactivity in that region, it is compounded greatly by infections like Lyme. And so we focused first on your brain. And you said Friday you thought you were 90% less pain. We've already figured out today you're going to do a kill on your own as you make you healthier. Why would you start killing bugs today that you weren't killing before with antibiotics? You had, I think, 9 months or 8 months of antibiotics.
Yep.
And 5 months were IV antibiotics.
Yes, with oral
Okay.
antibiotics.
And we were probably killing more bugs already in a week of our treatment without the antibiotics, without even going to our natural Lyme treatment, our natural Lyme kill protocol. You're killing, and you have a fever of 99 point something today.
Yeah.
Here's the issue. We made you healthy, but we first made your brain work. So we're going to talk about, why you had the brain fog, even starting at age 12, 14. Things got really bad at around age 23. Total body pain, burning pain. But the brain is the voltmeter. Think about this. If I have a pinched nerve, sciatic nerve, a disc, or a bone pushing on that nerve,
Right.
if we step over this way, the pressure goes on this cushion, the myelin. If the myelin is inflamed from Lyme toxins or mold toxins, you're way more sensitive to the pain. The burning pain that you described throughout your body comes from the myelin being inflamed. But in the end, wherever the pain starts, whether it's the foot, the leg, the shoulder, the pain signal, an electrical signal, comes up the spinal cord and into the voltmeter. The brain is, of course, the voltmeter. So whether your pain feels like it's a 9 out of 10 or a 3 out of 10 can greatly depend on the electricity in the brain. Now, when you have these infections in your brain and toxins in your brain, the brain becomes over-electrified. When it becomes over-electrified, you feel more pain. If a 3 out of 10 pain comes up from your sciatic nerve to a brain that's over-electrified, it amplifies the pain coming in. And what you would have developed from the antibiotic treatment is a lot of gut toxicity, overgrowth of bad bugs, and they cause a shift in all kinds of things. And when they cause leaky gut syndrome, your histamine level goes sky high. And this is an example of what a brain looks like just from gut toxicity from antibiotics. And so your brain, if you had had a SPECT scan, which measures the blood flow and tells you which regions are overactive versus underactive, you would have seen excess electrical voltage through indirect measurement versus calm. So that brain would amplify the pain signal coming up if you're over-electrified versus normal electricity. Furthermore, you develop an overactive deep limbic system or emotional center from the antibiotics. And we did our research on this probably in 2007 and 2008, measuring the brain chemical changes caused by the antibiotic treatment. And essentially by the overgrowth of bad bacteria and bad yeast that God had no intent to be in the gut. So we've done extensive research on the gut being the second brain. And people will talk about that throughout the country, but no one has looked at the individual brain chemical changes as we have that cause this region to become severely overactive, and it makes you more sensitive to things people say. Did you notice, did your wife notice you become more moody, irritable, and easily offended?
Oh, yeah.
Since you had the antibiotic treatment.
Yes.
But you're also more sensitive to physical pain, not just emotional things. And so what we did is we began to bring this guy down to normal activity within days of our intravenous therapy and the oral natural medicine we use. We have moved your brain from this brain to this brain. This brain is depressed from this region being overactive, negative, moody, irritable. You're less social than you used to be. Hopelessness, excessive guilt, easily offended, and more sensitive to pain throughout the body. So we start with the brain first to make you happier. And you were joking and laughing the other day and said you were happier than you've been for, what, 20 years?
Yeah.
Maybe more. And one of the reasons is we move this region back to normal. The other region up here in the front of the brain, the anterior cingulate gyrus, makes you worry, and hyper-focus on your pain. So the brain is the key first. Optimizing the brain function, bringing it back to normal, will decrease your pain sensation body-wide. Does that make sense to you?
Yes, it does.
And I'm sure your wife has seen and other people have seen how much more upbeat and happy you are.
Yeah.
Okay?
Big difference.
Big difference? Yeah. Now, in fact, the first day I saw you, before we started treatment, I guess it was Monday or Tuesday of last week, you couldn't laugh like you just did. You kind of sit there and fake the smile.
Yeah.
I've treated thousands of patients like that. Going back to what you inherited, if you inherited slightly underactivity, because it would have been mild in you, very mild underactivity in this frontal lobe, and it's actually above the right eye, that the dopamine D1 receptor has the action of focusing the rest of the smart brain, okay? Of breaking your thoughts so you can turn your brain off at night. It actually modulates the highs and lows in the middle midbrain where you have the emotional center and the reward center, so you don't go too high, too low. So when this region is shut down, the rest of the brain is not functioning properly.
Right.
So downregulation, if you will, of electrical activity here, from genetics initially, but then from the Lyme spirochete. The Lyme spirochete lives throughout the brain, but tends to congregate, again, according to Japanese studies, very recent studies. When it congregates in this frontal lobe, you lose that 4-second memory. Your 4-second processing memory is down to 1 second. And so you can't focus as well on new things. You can spit out old information fairly well, but to try to analyze on the job or learn new things in school, very difficult, see? But furthermore, when this region is shut down from Lyme toxins, we end up with a brain that is not being regulated, modulated, whatever word you want to use, correctly. And because the brain is top-down management for the entire nervous system, we can agree on that, right? And now neuroimmunologists are saying very clearly the immune system is simply the tail end of the neurological system.
Right.
So if the brain is downregulated, particularly the executive center of the brain, the prefrontal cortex, how's the immune system going to work?
Right.
So, furthermore, the reward center, which sits further back, it's called the nucleus accumbens, is modulated by the electrical activity up in the prefrontal cortex. That's been proven, probably the best research lately is out of Madrid, where they've proven clearly that the release of dopamine inside of that reward center that I told you in my opinion, based on asking questions, and I can prove it with genetic testing,
Right.
but I've done it in thousands of patients, probably 8,000, proving whether or not they had a downregulated or underactive emotional center. It's very common. Reward center. Very common, and causes people, again, not to get excitable. But when that reward center is down in kind of a black hole, and you could probably describe, and you did when I asked you last Monday, kind of living in a black hole. I've had patients describe peeking out of the black hole and looking at all their friends laughing, and they're trying to laugh, but they can't. You were down just a little bit, in my opinion, and what we've seen with studies from the National Institute of Health and other PET scan studies is patients have inherited 10% less happy receptors, 20%, 30%, and down to 50%. In my opinion, you were probably down 20%. So you were already predisposed to being knocked down in a deeper black hole by the time you get to Lyme disease. But the key here is, as well, that leaving this region underactive, this reward center, underactive because of issues in here, makes you more sensitive to pain as well. Again, the voltmeter, and what I've seen in thousands of patients, is if the reward center, the nucleus accumbens, is underactive, they're more sensitive to pain. We did in a 4-day period, by Friday you were having all this joy, happiness, and energy, and less pain. We moved this brain over to this brain, and we lifted the activity in your reward center and your frontal lobe. Today you're killing somewhat, your temp's 99 point something, so you don't look near as good as you did the other day, but that's okay. We have to move forward now with killing bugs. But do you see why we wanted to work on the brain first?
Oh yes, it makes complete sense.
It activates the immune system, and you know, brain treatment, brain expertise is what really, of all things, I think differentiates us from other Lyme treatment physicians. If you can't treat the brain, knowing how terribly, just incredibly Lyme affects the brain, you really can't get the patients better. If the brain's not working, the immune system's not working.
Right.
If the brain's not working well, if you have overactivity in this particular region and underactivity in the reward center, you're going to be more sensitive to pain, beyond the depression, lack of motivation, brain fog, inability to function. And you said you've had the pain for at least 15 years.
Oh yeah.
But you've been out of work for what, 2 years?
Yes.
Wow. So you couldn't go to work because of pain or because of lack of brain function, body function, or what?
Pain was number one, but it's a combination of everything.
Wow. What kind of work were you doing?
I was operating a forklift.
You have to be focused.
Yes.
It requires a lot of coordination.
That's why I had to quit.
Well, so let me add one more thing. When the prefrontal cortex is downregulated from Lyme and these other toxins that we found in you, some of the mold toxins, it does not stimulate activity to the cerebellum. We have in the past, historically, given all the credit for coordination, which you need badly if you're moving around, pulling levers and stuff. We gave all the credit to the cerebellum. As it turns out, the prefrontal cortex, the first region to shut down from Lyme disease, has a tract going to the cerebellum, and patients become less coordinated. In fact, a lot of Lyme patients develop what's called ataxia, where they can't walk well, they've lost their balance. And you may notice you're not as coordinated as you were before you got sick, and you may have become more coordinated even by the end of the week, which now you may be losing because now you're creating more toxins than kill. But
Right.
obviously you can see how important the brain is.
Oh yes, definitely.
And I wanted to explain to you, and I appreciate you letting me explain to you these mechanisms somewhat on the video. And we're just getting started. Then we'll hear 1 week. This week we're going to focus on moving toxins out of your brain. We're going to try to push you out of a kill and start moving these fatty toxins out of your brain and nervous system. They tend to congregate in the brain. Even for Lyme bug, is in all the cells and all the different systems. We know it's been isolated in the intestinal tract. It's been isolated in muscles, in skin. But the toxin that's produced is a fatty or lipophilic toxin. And the lipophilic fatty toxins move throughout the body, and they tend to saturate and congregate in the brain because the brain is the fattiest organ. Some studies show up to 60% fat. The other place they congregate and saturate and inflame is in the myelin. This myelin on the brain nerves and the sciatic nerve, this is 80% fat. And that's why they cause the neuropathy and the burning pain. So we are going to start tomorrow with giving you intravenous modalities of treatment to push the bad toxins out of the myelin and out of the brain into the bloodstream. And then we're going to try to grab those toxins and move them out with our detox treatment, etc. So then we will go into a kill mode probably after another week or two of that. Your brain has been probably hit with mold toxins and Lyme toxins since age 12, at least. So a lot of years of inflaming this myelin. Now I don't think you're to this point where you have scarring, which is seen on MRIs as white spots or bright spots. You could. I've ordered MRIs on many Lyme patients. When I see intelligent people come in here, they've had these powerful jobs, and they can't add the first time you meet them 7 plus 9. I mean, I'm embellishing a little, but they really can't focus. I ordered the MRI, and it's more often on females. We see this; they have more MS stuff. And what we'll see a lot of times is inflammation, increased T2 inflammation of the myelin, and we can get rid of that in 2 weeks. We've proven it with our intravenous treatment on top of everything else we do.
Right.
Many hormones are needed to heal the myelin. When you have the scarring, as in white spots, bright spots, it takes longer. I don't think you're there yet, because I saw how well your brain worked Friday.
Mm-hmm.
You could have gone to work Friday after 4 or 5 days of treatment
Yeah.
before you went into a kill over the weekend, which I kind of figured you would. So anyway, makes sense to you?
Complete sense.
All right. Well, let's keep going.
Yes, thank you. I
Take care.
appreciate it.
You bet.